And we move now to heart disease, which, according to the American Heart Association, is the #1 killer of women. And here in Nevada, 1 in 3 women is said to be living with a form of heart disease. However, with the right care and treatment, it can be managed and even lessened. Maria Silva is in studio with 2 local doctors on a mission to help keep women in control of their heart health.
Thank you so much, Amber. It is my honor to introduce to you Dr. Kathy Benson. She is a cardiologist with Advanced Heart and Vascular Specialist. We also have Dr. Kate Zong, who is a UNLV professor, go Rebels, with the Department of Brain Health. She's also a geriatric psychiatrist, pharmacologist, and brain health advocate. Thank you both so much for joining us to discuss this very important topic.
Thank you.
Thank you for having us.
I do want to start with you, Dr. Zong, because your story, you're here as a patient, so talk to us about your situation and how now you've become really an advocate when it comes to women's heart health.
It's such a life-changing experience for me. You know, I, as a physician, I'm very vigilant about my lifestyle. I eat healthy, I exercise, and I don't usually have a lot of other risk factors associated with heart disease, such as hypertension, high cholesterol, and diabetes, so on and so forth. So I just consider myself, in general, very healthy. But just about half a year ago, I started to feel tired. I started to have palpitation, and my heart was racing from time to time. And I didn't think too much about it. I thought, oh, you know, I might be just stressed and overworked, and didn't pay much attention to that. But that symptoms continue to the point that woke me up mid of the night. 12 o'clock in the morning, I was having a heartbeat of 100.
Oh, wow.
And I knew something wasn't right. So then I went to see my primary care physician, who did a fabulous job, you know, did all the blood tests, all the physical examination, and EKG. Everything came back normal. So there's really nothing wrong, quote unquote. Then I went on with my life. I thought, you know, I was just going through some changes in my life. But that continued, and I went back to my doctor. Then I went through the Holter monitoring. I wear that machine for 2 weeks. They were checking my heart rate, right? So again, the result came back perfectly normal.
But you knew in your heart that something wasn't right.
Exactly. I knew something wasn't right, but what could that be? So I think this is where I pause. I want to share with our audience, you got to listen to your heart. You got to listen to your body. When you know something is not right, you have to act.
Because again, you went through so many tests and they kept telling you that everything was okay.
And everything came back normal, right? And again, you know, I have no family history. I have no other risk factors. I wouldn't automatically associate that with me having a heart problem. So luckily.
And let's talk about that because, again, serendipitous, both of you meet up. Let's talk about that. Dr. Benson.
So I met Kate actually almost over a year ago. We knew each other socially.
Right.
And then she and I met up and she had shared her experience or her symptoms with me. And we discussed that maybe she needs further testing.
And what testing did you receive?
So she said, I really want you to come to my office. And she's very persistent.
Which is good. We need that, right?
Which is very good. I'm very grateful because she has seen so many female patients who have experienced similar symptoms as I have. So I went to Dr. Benson's office and then she checked me out. Again, you know, blood test and EKG, which was all normal, right?
Yes.
Initially. Then she persisted. Thank you, Dr. Benson. She said, I'm going to do more. So from there onward, I had stress tests. You know, I went on the treadmill and you ran as fast as you can for a few minutes. And from there onward, I went on this patient journey because the stress test came back abnormal, right?
Yes.
So then Dr. Benson said, we're going to do more. We're going to investigate more. So I then proceeded with the next test, which is CT scan of my heart with contrast and Sunrise Hospital. And then on one Thursday afternoon, she called me. She said, I want you to come to the office. I said, okay. So we sat down. She pulled the report. She said, I don't like what I see here. My heart sank, literally. Then she told me, Dr. Benson told me that I have 50% blockage of my main left artery. That's pretty serious, right?
Yeah, and let's talk about that, Dr. Benson.
Please.
The tests that you did, again, you yourself said we need to do more. I mean, a lot of times other, patients may have stopped at the first few tests, said, no, everything's okay, I'm just going to go on with my life. But you were persistent as well, and you said, come on in, let's get more testing done. Tell us about her diagnosis.
I recommended a stress test. When she exercised on the stress test, that indicated that there was some strain to her heart when she was exercising. And because of that, we know that females have different types of heart disease than traditional heart disease that we think of. And knowing that, we pursued more testing.
And let's talk about that. You bring up something that's very important because it does impact women differently than men.
Mm-hmm. Well, yes, exactly. So women, we have a lot of gender differences between our presentation of heart disease and our diagnosis of heart disease and what exactly is causing our heart disease. We might not have the traditional Hollywood heart attack that everyone thinks of, a man clutching his chest. We might have symptoms of fatigue, dizziness, shortness of breath, palpitations. And these are very, very important things that we must keep in mind. Additionally, there's other testing that we can do to bring and elicit the very specific types of heart disease that are more common in women.
Talk about some of the symptoms that women might be feeling that they might attribute to stress.
Right, exactly. So just as Dr. Zong had mentioned, she was having fatigue, palpitations, shortness of breath, not so much, but more fatigue and palpitations. Lots of females have that. We have to keep in mind that it's not just because we're females or because we're stressed out. If it's transient, yes, but when it persists, we really have to keep in mind that it actually might be something more significant. So it's extremely important that we hold those things in mind.
And one of the symptoms that I read about was stomach pains.
Yes, so I was sharing with Dr. Zong how I explain it to my female patients, anywhere from your nose to your hose, front and back, both sides. So if you have any discomfort in any of those regions, it could be your heart because of the way that the heart senses what's wrong with it.
And Dr. Zong, how are you feeling today?
I'm coping. So that I just want to come back to the test because I think that people have to be quite aware of the journey that they need to embark on. So it's not overnight. So after the CT scan, then I was with Dr. Benson, then she decided I need to do more tests. So then I went ahead and had the angiogram done. And so that's another test that I went through. And so that the result was such that I didn't have the plaques built inside my main artery, because that's very common among people who have coronary artery disease, but rather I have a condition called the vasospasm, artery spasm, that will cause constriction of my artery. So therefore will impair the blood supply to the heart muscle, then cause my symptoms.
Angiogram, explain to us what that is.
So an angiogram, so there's several ways to look at arteries. We did a non-invasive angiogram on Dr. Zong initially to get a general idea, which is a great test for female patients. Following provocative tests like stress tests to elicit whether we have true blockage, as Dr. Zong had mentioned, or we have maybe something like spasm. But as in Dr. Zong's case, it indicated something more serious, hence an angiogram. An angiogram is an invasive test. We actually go inside of the body through an artery in the arm or the leg, and then we inject dye into those arteries to actually see, as Dr. Zong had mentioned, whether there's plaque buildup within the arteries or there's something else structurally wrong.
So what advice do you have for women of all ages? Because we will talk about the fact that younger women as well. I think a lot of times there's this misconception that it only impacts people of a certain age when you're older, but not the case.
No, not the case. So advice to, as we had mentioned here several times, is to be your own best advocate. So if something is transient, it's transient. If it lasts longer than 2 weeks, you really should have that checked out. And again, even if somebody says it's nothing to worry about, if you feel concerned, you can always seek some advice with another physician, another type of cardiologist, another type of primary care physician, so at least you feel some comfort in the recommendations that are given to you.
And again, the symptoms, let's go through some of those symptoms.
So traditional symptoms. So women are not immune to the Hollywood heart attack symptoms. So chest pressure, heaviness, sweating, nausea, those types of symptoms. However, We have other symptoms that are more specific to women, and we see those also in some older patients and those with diabetes as well. Fatigue, shortness of breath when you exert, shortness of breath at rest. You start feeling nauseous, you have any discomfort. I have some patients who truly have heart disease and they have right shoulder pain or right scapula pain, or that's in your back. So these are important things to know.
I think also that the fact women's heart disease tend to be overlooked at for multiple reasons. One is that when we were in training, we were trained in such a way that it's classical symptoms, and it's primarily chest pain and men. You know, like we heard about the widow's maker, right? And it's really describing men having a heart attack, not women having a heart attack, right? So from the physician's perspective, we were trained textbook-wise, recognizing your typical man kind of a heart disease, not women. But it's changing, so it's a really good thing. And secondly, I think as we heard from Dr. Benson, the women's heart disease and heart condition tend to have somewhat different presentation symptoms. So we have to become more aware of that, myself included. And number three, I think is even more important for women. We tend to really devote a lot of time and effort and our attention to everybody else around ourselves, right? So when I had the problem, I said, oh, you know, it's just maybe a little stress. And then, you know, I overworked, and you know what, you know, I take a bath, I take a vacation, things should be better, but it's not. So your health comes first. You have to be your best advocate for your health. You have to listen to your heart. You have to listen to your body.
And I do want to share an interview that we did with Kristen Kidman, who is our executive producer here at Nevada Week. She first diagnosed at 34 years old. Again, we talk about it's not just, it doesn't discriminate when it comes to heart disease. And I want to share her story, and I want us to comment after, because while you were feeling the heart palpitations, she wasn't feeling anything at all.
I went to the doctor about 2 years ago and thought I was having one issue, and while they were just doing a regular blood pressure check, they came back and they said, you know that you're at 210, right? And I said, what? And that's what it was. And then my minor issue I went in for became this whole big emergency. It was a whole production. I had to have so many tests done. So then at the time they said, you have high blood pressure. We need to get you treated for this right away. And then now, just same thing again. I went to the doctor for just something minor, and they discovered some more heart issues. They discovered an irregular heartbeat. They discovered maybe a blockage. They're not really sure yet. That's what I'm being tested for. My grandparents have heart issues. My parents have heart issues. Now I know I have it, and so it's something that I've tried to work with my son, just making sure that he's eating really healthy. He's getting a lot of exercise. We try to do family workouts together. Now that I know that I have this issue, and I know what the risk factors are, and like I know what triggers it now. So for example, say I eat something really salty, or you know, I have like too much fun on a night out, or maybe I forget to take my medicine, I'll feel my heart rate go up. I'll feel my blood pressure go up, and it does hurt. And stress is a big part of it. I work in news. That's always just been my little stress bubble my entire career, but it's making me pick my battles, right? So when I come home at the end of the day, I can either pound out and clean my house and get a whole lot of things done, or, you know, if I'm just not feeling it that day, I have to put my heart first and put myself first and just relax and try again the next day.
It sounds like she had a component of hypertension or high blood pressure, and so high blood pressure is the silent killer. Yes, so that's another thing that women need to be aware of. And additionally, you know, we'll find where women have palpitations, and you know, even if they're diagnosed with an irregular heartbeat, they're thought that, oh, well, you'll be fine. You just take some medicines and you'll be fine. But what actually we know is from some studies that were done is that these women who do have these conditions, actually they fare worse than those who do not over a period of 12 years when they're followed. So it's important to get diagnosed, to follow up, and to change lifestyle and medication management if necessary.
And I do want to bring up, because we talk about heart disease being the #1 killer of women, we don't have resources here in Nevada, doctor. Let's talk about that. We were talking off camera and I said, that's disheartening. And it is shocking given the fact that it is the #1 killer and we don't have a center here for heart disease, especially when it comes for women.
Sure, we don't have a concentrated center for women, you're absolutely right. We do have many well-educated cardiologists who are aware of this condition and these conditions. It's a breadth of conditions that affect women. But with regards to a concentrated center, no, we don't. And I think other very large communities, which Las Vegas is rapidly becoming one, do have these types of resources. So we think that that would be something in the future to concentrate on.
And that's something that both of you have discussed. And what needs to be done, Dr. Zong?
I think as a patient and as a physician, as a Nevadan here, and I think it's so critically important for us to really think about what we can do here to establish a center for specializing women's heart, not just for the treatment, not just for the diagnosis, but I think for prevention, more importantly. So I think we need to raise awareness, we need to raise funds, and we need to get our entire community gathered behind this initiative.
And as doctor, before we leave, I do want to talk, because it's important to mention our rural communities who don't have access to doctors.
Right. So that's always a challenge, having a cardiologist go into the rural communities. I'm actually aware of several cardiologists who do travel to Elko. They travel to small rural communities to offer services. In terms of prevention, those still sort of focus on the main centers. Additionally, reaching out to our primary care physicians as well to know that prevention also starts with them. So they don't necessarily need to see a cardiologist for prevention, but occasionally you will have more specialized heart disease prevention with a cardiologist. Telehealth has improved some of those boundaries to access to care, to specialties per se in our communities, our small communities. However, it's still ongoing effort always.
And where can we get more information? I know the American Heart Association, their website has great videos, everything from learning CPR, which is so crucial, to for women also knowing the symptoms and risk factors.
So American Heart Association, there's Go Red for Women. There's also Women Heart, which is an organization in the United States that actually focuses on this very important topic.
Thank you both so much. And final words of advice?
Listen to your heart, take care of your heart, and be your own advocate.
I love your necklace, by the way, beautiful heart. And doctor?
Yes, same actually. Advocate for yourself, always know when something's wrong, and again, listen to your body, and then get out and educate your family members, your friends, your children, your spouses. It's very, very important that we get the word out that this is a very, very important killer of women, most important top killer in the United States.
Thank you both so much for the great work that you're doing. Appreciate you both.
Thank you.
Thank you for having us.
Amber, back to you.